So now I have a question about that. The news has reported that the Moderna and Pfizer vaccines are 95% effective. Does this mean that if I get the vaccine, I won't get infected with the SARS-CoV-2 virus?
That means that there's a 95% chance that you will not get symptomatic infection, namely that you won't get infected to the point that you get symptoms.
But
we are unsure right now what the protection is against infection, because it's conceivable that you could get vaccinated, get exposed, get infected, not know it because the vaccine is protecting you against symptoms, but that you could have virus in your nasopharynx, which is the reason why we say until we prove that the vaccine prevents transmission, that people who are vaccinated should wear a mask when they're near people who might be vulnerable to infection.
Yeah, but I think it's a different thing. To stop the clinical disease or the symptoms is different from getting the virus, the infection, right? So basically, the vaccine lowers my symptoms, but it may not prevent me from being infected with SARS-CoV-2, which means there's a possibility that I can still spread the virus even after I receive the vaccine. Correct?
That's the reason why that's the reason why we ask you to wear a mask after you've been vaccinated. But the evidence is accumulating that the level of virus in the nasopharynx is very low, and it is unlikely that you would transmit it. But just to be sure, we're saying wear a mask. In the next couple of months, we will get enough data to be able to prove whether or not, if you get infected despite the fact that you're vaccinated, proving that, in fact, it is a very, very low risk that you would transmit it to someone else.
Yeah, but because I've been reading, and I saw that you stop getting the symptoms, but you still can get infected, and you can still spread it. So that was so. What is the main aim of the vaccines if they neither stop you from getting the virus or transmitting it?
Right. The main purpose of the vaccine is to prevent you from getting sick, going to the hospital, and maybe dying. That's the main purpose of the vaccine.
Okay.
The main purpose of the vaccine in general is to prevent you from getting clinical illness. We believe that when all the data come in, we will prove that it also prevents you from transmitting the infection to other people.
But not yet, right? That's what I suppose you keep telling everyone they need to keep wearing the mask even if they get vaccinated.
Absolutely, so, that's true.
Tell me, Dr. Fauci, how come we still need to wear masks? I believe totally in masks and social distancing, but how can we still need to wear masks after being vaccinated? And other question, under these circumstances, when are we going to go back to normal? Are we going to stop using the mask someday?
Absolutely, absolutely. And let me tell you what you can do right now. If you are vaccinated and you are with a person who is also vaccinated in the setting of the home, if you're with your mother, your daughter, your wife, your friend, if you're with people who are also vaccinated in the setting of the home, you don't need to wear a mask, and you can have physical contact. You can hug your children, you can hug your mother or your father. You can do that if everyone is vaccinated. Even if some are not vaccinated, as long as they are not at risk for serious disease. Namely, let me give you an example. Suppose a grandmother is vaccinated. She wants to go a few houses down the block to see her daughter and her granddaughter. If the daughter and the granddaughter are not vaccinated, the grandmother can still go in there so long as the daughter and the granddaughter don't have an underlying condition that make them susceptible to a severe case of COVID-19. If they're normal and healthy, the vaccinated grandmother can go visit the daughter and the granddaughter, take the mask off, give them a big hug and give them a kiss. You can do that.
Okay, but I'm confused with something. I thought herd
Okay.
immunity. I thought herd immunity works because by being vaccinated, I block the virus from spreading to other people. But
Right.
this vaccine may not do that. So how does herd immunity work if I can still spread the virus even after getting the vaccine?
Now, but the fact is the vaccine protects many, 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 many people from getting infected. Some people might get infected and they might not even transmit it. We know that some people get infected. We know that. But not everybody who gets the vaccine is going to get infected without symptoms. So the overwhelming majority of the people who get vaccinated not only will not get sick, they won't get infected. But there will be some who might be infected. And when they
So,
are infected, it is unlikely that they will transmit it.
so there's a possibility that the vaccine can turn people into what is called asymptomatic carriers, which means they don't have symptoms, but they're still contagious, correct?
Yes, we've said that. That's true. But we're
Okay.
showing as the time goes by that it is likely that those people have a very small chance of transmitting it. We won't know exactly how much until we follow these people for a considerable period of time.
Okay. And Moderna